Hello, humans. Today I want to talk about women doctors, historically speaking. Um, this is a topic that I've been researching for a while, and yeah, I want to point out that the word which is doctor or physician or medicine, is relatively high status. There were many types of women healers, like midwives and wet nurses and grannies who prescribed herbs and so forth. But those all had a lower status, as did, some male healers. It's not only women. And so if somebody's called a new it's saying that they have a certain level of knowledge or education that's higher than a midwife. And I totally respect midwives, but this is just the reality of Chinese culture. However, a woman doctor would always be looked down upon by male doctors. I mean, they may understand and think, great, a woman doctor could treat some of the women in a house or whatever, but they still didn't think that women doctors had the same status. Still, they had a higher status than midwives. And, one of the things, both for males and females, is that um, it was better if you used a brush and ink than if you touched excretions from the patient. So if you got your hands dirty with blood, that was going to be a lower status. And so that's one reason why midwives had a lower status. Or even like Shanka practitioners, traumatologists probably were looked as a lower status than doctors who just only touched the patient to feel their pulse and then wrote an herbal prescription. Another reason that acupuncturists were not as high status is because they're obviously touching the patient's body a lot more. So, anyway, not all people who were called were literate, but most, or I don't, who knows the percentage? But of course, the ones that we know about were for the most part literate because they wrote books. Um, so was, not totally about literacy, although it that tended to add towards it, but there still had to be a certain level of knowledge, whether it was passed down through the family or book learning or a combination of that. So anyway, we're talking about the highest level of healthcare practitioner that a woman could be judged as. That doesn't mean that, everybody, looked like respected these women, because we have many writings from doctors where they're complaining about this woman doctor was getting in my way and stuff like that, or these women doctors, they don't know anything. Comparing them to barbarians and comparing them to eunuchs and stuff like that. So, there's a big status difference between a woman doctor and just a doctor. And, then there's also a status difference between a woman doctor and other female types of healers, other types of female healers. Anyway, I want to talk about today. I mentioned 7 women doctors that we know existed historically. So this goes back all the way to the Han Dynasty, 2000, more than 2000 years ago. I'm not saying there weren't women doctors before that, but, I haven't found any record really before that. So, Shiji is the historical records written by Sima Qian that are considered like really, it's an amazing document. But that's like a whole nother story. It's huge. And one of the chapters is biographies of cruel officials. Okay. And in it, there's a biography of somebody named Yi Zong. This story is also in the Hanshu, which is the history book of the Han Dynasty. And so, oops. Uh, so here's the bad guy, not the doctor. His name is Yi Zong here. He was from a place called Hedong. And when he was young, he joined a group of thieves and he attacked and robbed people with some other people who apparently were famous. And he had an older sister who was good and not like him. And she practiced medicine. And the queen mother, the mother of the emperor, really liked her. So the queen mother asked her, "Do you have a son or a brother who can become an official?" And she said, "My younger brother has no morals, so, don't call on him. He can't do it." But the queen mother, anyway, told the emperor, and he honored Ishu's brother, this bad guy, Izong, and gave him a rank as whatever an inner gentleman is, someplace. That's all we know about her. We don't really know anything else about her. But since he was a bad guy, then of course a lot of bad stuff happened. Um, and that's not our issue. Today this is only to say, okay, there was a woman doctor who treated the Queen Mother back then. And she so since then, two people wrote novels about her, or there are a couple of different novels about her and her life. So if you search in Chinese on the internet, you can find, a bunch of stuff about her life, but there's no citations for it. And so even though, yeah, you can find more details about her life, they're probably all made up and fictional. And this is all that seems to be documented about her, is that she had a bad brother and that she served the Queen Mother. Anyway, so that's the first woman doctor that earliest that at least I was able to find. There's another one that's also in this Hanshu, the history book of the Han Dynasty. And it's in the section called Biographies of the Royal Family on the female side. So not through the paternal line, but through the maternal line. And apparently there's a bunch of volumes of this. So this is like part one, whatever. Anyway, so there's a woman doctor named Chunyu Yan. Chunyu is one of the, less common Chinese names that has two syllables rather than just one. But Chunyu is a name. In fact, there's a really famous Dr. Chunyu Yi who was written about in Shiji, the historical records that I mentioned with the previous doctor. So, but we don't want to be like her. She's a bad guy. At least that's how history tells it. But remember, history is written by men, and there was a lot of what we would call today misogyny because, a lot of men didn't like women having any kind of power or influence or skills. And so, this is the story that's written, but we don't necessarily have to believe this is how it actually happened. So anyway, so this was supposed to have happened during the reign of a Han emperor named Xuan, 74 to 48 BCE. Mm, translating this really ancient stuff is hard. I spend more time in the Ming Dynasty, Qing Dynasty, much, much, much later. So this isn't really like exactly a translation. I kind of paraphrased, some of it. Hopefully I understood it, but I didn't really translate it all. Some of it I put in my own words. Okay. So there's somebody named Lady Xian, and she's the wife of a general whose family name is Huo. Women, when they married, kept their own family name. They didn't change names like we do today in the West. Okay, so they had a daughter, and she wanted her daughter to achieve a high rank, but there really, wasn't a path. And so she's scheming to get her daughter like a higher position. So the next year, the empress, her name is Shu, became pregnant, but she was pretty sick. And so this female doctor, Chunyu Yan, was like a doctor that the Huo family liked, the general's family, including his wife, liked. And she had entered the palace to look after the empress. Her disease. Oh, I think I might have misspelled empress. Yeah. Anyway, whatever. Um, and her husband was rewarded for Chunyu Yan's service, and he was given the position of a guard someplace. But he wanted something that he thought was better, so he asked his wife, the doctor, "Can you ask the lady Huo, which is the lady Xian, can you ask her if she can have me move to a different post someplace else?" So Chunyu Yan went to talk to Lady Xian, and she sent her servants away because she wanted to talk privately to Chunyu Yan. And she was like not upright. She was disloyal. So she said to Chunyu Yan, "You want to ask me something, but I also want to ask you something." And Chunyu Yan said, "Of course, you can ask me anything. Why not?" And so the lady Shen said, "The general really loves our daughter. Her name was Changchun, and he wants her to receive a special rank. So I want you to help me with this." And in the beginning, it said she was really the one who wanted the daughter elevated. So who knows what the truth is? Maybe both of them wanted it. And so the doctor, Chunyu Yan, says, like, "What are you talking about? What do you want from me?" And Lady Xian said, "10 women die and only one lives during childbirth." Wow, if that was true, that's pretty horrible statistics. That's not really true, but that's what she said. The Empress is about to give birth, so we can remove her using toxic herbs. And then the Emperor might elevate my daughter, Chongjun, to become the Empress. And so if we can do this, both of us are going to profit, meaning I'll help you, I'll give you wealth and honor, you know. So Chunyu Yan said, "Many herbs are used to treat patients, but I'm supposed to taste them first. So how am I supposed to do this? You know, if I give her toxic herbs, but I have to taste it first, then that's going to get me too." And Lady Shen said, you figure it out. My husband, the general, commands all under heaven. Apparently, he was a really powerful general. So who would dare to speak up against him? If my husband supports us, then, nobody's going to do anything to you. In emergencies, we should protect each other, but I fear you're not interested in this proposition. Maybe there's some threat in this to her, like saying, "Who would dare speak?" Like not only do I want you to do it, but if you say a word, if you don't do it, then maybe he's going to act against you. I don't know if that's implied, but she could be afraid that if she doesn't, she'll have disfavor and this lady will make up bad stories about her and have her punished. So she thought about it for a while, and finally Chen Yuyan said, "Okay, I'll do my best." She then pounded some fuzi into powder and brought it into the palace. So if you're a student or practitioner, then you know fuzi is a really important herb that is life-saving in some circumstances, but an overdose of it can, it has toxicity and it can kill you in an overdose. It has to be processed a lot before it can be used because of its toxicity. So you have to process it to reduce toxins. And yeah, you can overdose on this. So after the Empress gave birth, so hopefully the child's okay. Chunyu Yan combined the foods with some pills that are called the Great Doctor pills. I don't think we have that recipe anymore, but she made pills, including, a fatal dose of futsa in it. And she gave them to the Empress to swallow, and she probably made some pills without the futsa because since she had to taste her herbs before she could give them, then she probably knew which pills she could take and which pills she couldn't take, like how they were placed in the bowl or something like that. In a little while, the Empress said, "My head feels dull. Was there poison in the medicine?" And of course, Chunyu Yan says, "No, of course not." Me? The Empress soon felt vexation and oppression, like she felt agitated and like she couldn't breathe and so forth. And then she collapsed. Chunyu Yan left and went to see Lady Xian, the one who instigated this. And Lady Xian expressed appreciation, but didn't want to reward Chunyu Yan yet, wanted to see what the fallout was, want to see if the Empress actually died, wanted to wait, didn't want to look suspicious. And so later, someone submitted a document reporting that all the doctors were negligent in caring for the sick empress, that she died because the doctors didn't do a good job. So all the doctors were arrested and jailed by imperial order. But Lady Xian was frightened and told her husband, Huo Guang, the general, "Things are already a mess, but don't let the officers torture Yan." Not because she cared about Yan, probably, but because if she was tortured, she might tell the story. And then, of course, Lady Xian and probably the general would all be in big trouble. And so Huo Guang apparently wasn't in on this conspiracy. And he was so alarmed, he was speechless and he didn't respond. But afterwards, he submitted a report to the emperor and signed an order for them to leave Chunyu Yan alone. So we don't know what happened to her afterwards. We don't know if she got a reward. We don't know what happened to her husband. We don't know if she still worked in the palace or for Lady Xian. But that's like the story. And it goes on from there, because it's a historical record. So it tells, what happened. And so this daughter of theirs did become the empress. And so Lady Shen got what she wanted. Now, of course, as I said before, this was written by men, and men often didn't like women doctors, although, of course, for high ladies in the palace, a male doctor couldn't really freely see them because they were very much sequestered away from other males. And so they were necessary, but most men thought they were necessary evils and not up to standard and so forth. And so this could all be a thing to blame Lady Shannon, to blame Chunyu Yan just because they were female. We don't really have to believe that this is how it happened, but this is what the history books say. And this is what most people are going to say if they tell the story. I just think we should be skeptical when they talk about women who have skills. Okay, so those were two historical women doctors that were both in the palace. In the palace, there really isn't necessity for female healthcare practitioners because, as I said, the empress and the concubines are really sequestered from unrelated males or even from related males, probably, besides the emperor. That's part of why they had eunuchs and so forth. But, the rest of these, I don't believe any of them were in the palace. And actually, the rest of these, I only have just a short blurb. But Bao Gu is somebody I really have a fond spot for. The thing is, I want to do more research and I'll eventually do, a separate episode about her. So here I only have like a sentence or two. She was a expert, so fourth century. This was a period of time called the period of disunity, and the dynasties were changing like so frequently. So I don't even care what dynasty she was, but fourth century, so 300 something. And she was an expert in moxa and external medicine, which means things like skin diseases and wounds and stuff like that. Her husband was named Ge Hong. You might have heard of him. He was also a doctor, and he's kind of famous for writing Zhou Beiji Fang, but who knows how much she participated in the writing of it. Who knows if she was literate or not, but even if she wasn't literate, she could have helped, with her knowledge. So anyway, there's not a lot written about her historically, although people, will make stuff up and tell stories, and poetry was written about her, like, ancient poetry hundreds and hundreds of years ago was written about her. And she's actually one of the few women doctors that's kind of fairly honored, and not thought of as less than. Well, of course, people think of her as less than Ge Hong, but she nobody badmouthed her, and they definitely badmouthed other women doctors frequently. Okay, so. There's some other women doctors that I had not really heard of until I started, researching in Chinese. There's somebody named Hu Yin, she was a Taoist as well as a doctor, and you could kind of tell by the title of her book, the Huangting Weijing Tu. So Tu is a diagram, Weijing is external view. And Huangqing is the yellow port, which I think has to do with the perceived path of the sun. Um, yeah, something like that. So the Neijing tool is this picture that you may have seen. It's like kind of, it means inner view, the Neijing. This is Weijing, the external view, but the inner view diagram is like if you're meditating and looking inward inside your body, and then you describe the anatomy of it in Taoist terms. And there's a famous diagram called the Neijing tool, not the same as Huangdi Neijing. It's a different Jing. And so anyway, I don't really know what this is. One day I'll do more research on this, but apparently she wrote a book that's known. I've been Googling it and I don't find it like a copy of it. Like you can't buy it in a bookstore or you can't find an electronic copy online, but apparently it existed even if it may be a lost book. And then here's another one, Zhang Xiaonyang, in the Northern Song Dynasty, Effective Formulas of Zhang Xiaonyang, is attributed to her, may or may not be her book. And again, searching, you can find in Chinese, searching online, mention of this book, but it's really hard to find this book. So these are future topics of research for me. However, these women, have written books, and the books existed according to, sources. These books existed. And so these were literate women who were doctors and wrote books. Here's a couple more. Somebody named Wang Hengqi, Qing Dynasty. So now we've jumped forward quite a bit. And she wrote a book called Essential Collection of Female Medicine, which is sometimes translated as gynecology. But what I've really found is that in the old days, the term female medicine just meant treatment of women, like a women's healthcare practitioner or something like that. And that Nuka books would include things like skin conditions and, other kinds of things that are not gynecology. So now I call it female medicine. 1881, and this book seems to be lost, but we do know it existed. And then another late Qing Dynasty book published in 1902 by somebody named Sun Chi Tai, medical cases from her studio, which was called something like the Daylight Star Studio. And so these are case studies, and I really would like to find this. Apparently, this book exists in some rare book libraries, but I haven't been able to find a copy of it, access to it. So this will probably be the next one I'm really looking for. And besides these, who I just have like a little one sentence thing that we know they existed, there are three other women doctors from late Imperial China who have lots of writing that's available. And so we know a lot more about these women and how they became doctors and what kind of practice they had and their style of medicine. And we have so much knowledge about each of these three doctors that I'm going to make separate videos for these three doctors. So I'm not going to talk about them here. There's Chunyu Yan, who some of you know, I translated her book, Miscellaneous Records of a Female Doctor, 10 years ago. And also that Lisa C. wrote a novel about her life. And then there's Gu Dehua, who is a Middle Qing Dynasty doctor, well, maybe late Qing Dynasty, the mid 1800s. And she wrote also a book of case studies, which I have translated. And at the moment I'm recording this, that is with the editor because it will be published maybe in 2025. I hope so. If not 2026. And then there's also somebody named Zheng Yi, who published in 1907, so just slightly later than this one. That's still the late Qing Dynasty. It's not yet the Republic of China. And I've, translated bits and pieces of her writing. I don't know if I'll translate the whole thing, but all of these women have stories of how they became doctors and stories of, interesting cases. So I'm going to make videos about them. Before I go, I want to just conclude saying that, you know, between the three that I'm going to talk about later and the ones I talked about today, those are 10 historical women doctors that we know existed in Imperial China, going all the way back for more than 2,000 years. And these women, they were either so important that they were mentioned in history books, or they were literate enough to write their own books. And some of their books survived, and some of their books don't seem to have survived, although they may show up in a rare book library eventually, because nobody knows they exist until somebody finds it and becomes interesting. But, if there are 10 that I could find out about, how many more, how many male doctors are famous? Well, a lot more than 10, but for every male doctor who's famous, how many male doctors were there that, never treated a famous person, so they were never included in a history book? How many, male doctors treated patients but never wrote a book? Or how many wrote books that were never published, or, and have since, only wrote hand copied manuscripts, or even books were printed, but not that many copies and they were lost. And so even among male doctors, so much history is lost, so much medicine is lost. And of course, there are going to be fewer women doctors, but women doctors' stuff would be lost at least as often as male doctors' stuff, and then even more because their writings weren't valued the same way the writings of a male doctor were valued. And so I just think, like before, I thought, wow, it's really rare. I found Tan Yun Shen, and like, what a rare person she must have been. And I still think she's an outstanding person, but I think it was probably much more common to have women doctors than we think, because the history books were written by men who didn't care about them, and the people who collected books didn't care about them. So they were lost at a higher rate. Knowledge of them was lost at a higher rate. So I think there have always been a fair amount of female doctors, and of course, there always will be. And I hope to keep, finding more of them and honoring their memory and bringing them back into our consciousness and normalizing the idea that there were female doctors, even if they were highly disdained, just like today we start learning about, the whitewashing of people of color who did outstanding things but were never famous, or, the like women who made inventions that were then patented by some male and claimed to be their own. We just need to be more conscious of people in history besides the dominant group. And so that's what I'm working on. Anyway, that's my thing for today. So there'll be more on women doctors coming up.